Okay. Thank you, Dr. Becker. Good afternoon, everyone. I am Marina del Rios. I am the Health Disparities Research Coordinator and Assistant Professor at the University of Illinois at Chicago College of Medicine. I'm also a committee member. We are going to start this panel with just a short 3-minute video from the Sudden Cardiac Arrest Foundation.
Each year, over 600,000 people have cardiac arrest in the United States. Today, only 7% survive.
I collapsed at a sudden cardiac arrest, and I was resuscitated at the age of 21.
49 the day after Thanksgiving. I was 45 years old.
At my desk in my office.
At a restaurant, celebrating my 48th birthday.
I collapsed. No pain, no reason, no warning.
Went in to get a cup of coffee, boom, dead on the floor.
It can happen to anyone, anytime, any place, and I know because it happened to me.
Sudden cardiac arrest, it's life-changing, not only for the victim that survives, but also for the family that loves that person.
I've been given the gift of my husband. He lived to walk his daughters down the aisle.
After my cardiac arrest, I never thought I would be around to see the birth of my grandson, and that meant a lot.
Emotionally and psychologically affects your family and your friends.
If your friend is down, don't you want to be able to act and help and bring them back to their son, their daughter, their husband, back to you?
We all need to learn CPR because CPR saves. We all need to learn how to use AEDs because they're effective tools in saving lives. It is as simple as that. It is.
We are all born with CPR tools right here in our own hands.
For all of the first responders, for all those learning CPR, for all of the doctors, electrophysiologists, and everyone in the industry, all I can say is thank you. And I can say thank you for my mother, I can say thank you for my father, I can say thank you for my fiance, and I can say thank you from me, from the bottom of my still beating heart, which is only made possible by you and your work.
Hard to watch that and not choke up a little bit. So I'll be moderating the panel on improving public awareness and training. Our panelists include Mr. Rob Davis from the U.S. Department of Homeland Security, Joanne Hose from the National Breast Cancer Coalition, and Raina Merchant from the University of Pennsylvania. Just speaking of public awareness, and after we saw that video, I just wanted to make aware everyone that there are 2 AEDs located at both entrances to this building. So should anything happen, we have that covered, and hopefully enough people here that will be willing to act. So this panel focuses on recommendation 2, which is meant to cultivate a culture of action in communities in response to cardiac arrest. And so just to reiterate what the report recommendation states, state and local departments of health and education and leading organizations in cardiac arrest response and treatment should partner with training organizations, professional organizations, public advocacy groups, community and neighborhood organizations and service providers, local employers to promote public awareness of the signs, symptoms, and the treatment of cardiac arrest. These efforts require cardiopulmonary resuscitation and automated external defibrillator training across the lifespan, creating a culture of action that prepares and motivates bystanders to respond immediately upon witnessing a cardiac arrest. I think the main message that we want the public to know is that as Dr. Heidi very well eloquently stated this morning, cardiac arrest is not necessarily the last event in someone's life, and that if we're all willing to act, we can actually make a difference. So just some rules. Each speaker will have 8 to 10 minutes to present. After all presentations, we're going to have about 30 minutes so that we can then have some discussion here in the room. We ask the speakers to please disclose up front any major conflicts of interest. With that, I'll leave you with Robert Davis.